A week after the World Health Organization declared a global emergency for the Zika virus, an Oklahoma woman shares her experience with the virus after being infected. 2 Works For You reporter Joe Henke live in Oklahoma City, where doctors at OU Medical Center discussed the virus today. Joe?
Well, Brian, by phone, Lauren Steverson, a 2015 OSU graduate from Tuttle, Oklahoma, joined the conversation. She's currently on a mission trip in Haiti, which is where she contracted the Zika virus last month. Now, OU Medicine held the conversation here today at the Children's Hospital. They said to bring context to the disease and what it means for Oklahomans. Steverson says she arrived in Haiti in early January and found out she contracted Zika 2 weeks into her trip. Her symptoms started with a fever, then a bad headache, back pain, and then a rash on her neck, face, and limbs. 2 weeks later, she says she's feeling better and plans to head home in March. She says where she is, others have been diagnosed with Zika, but in Haiti, education remains low.
Zika isn't a concern really until they have it, and then they are scared just because they don't know anything really about it.
Once diagnosed and educated, Steverson says most people she knows then calm down. Traditionally, we hear of Zika being transmitted by bites from the Aedes species of mosquitoes, but last week Dallas County health officials in Texas confirmed a sexually transmitted case of Zika. And for most people, the symptoms of a mild fever, skin rash, or pink eye last only a couple days or weeks. One lasting effect researchers are looking at, though, right now is in pregnant women. In some cases, their children are being born with microcephalia, a defect where a baby's head and brain are not fully developed. And even though Zika is not a new virus, it is being discussed right now a lot more on the international level and throughout the United States.